Welcome to World Missions University's Teaching Techniques, Ministry 113. This is Lesson 9, Impairments. Just as we try to include a wide variety of learning styles, intelligence levels, cognitive styles, we need to prepare to teach a wide variety of physical, psychological, emotional, and spiritual impairments. In preparation for this class, you should read Ministry to People with Disabilities, A Biblical Perspective. By the time you finish with this class, you will describe accommodation to hearing, vision, speech, learning disorder, and spiritual impairments. Consider Jesus' instructions in Luke 14:12 through 14. Then Jesus said to his host, "When you give a luncheon or dinner, do not invite your friends, your brothers or relatives, or your rich neighbors. If you do, they may invite you back, and so you will be repaid. But when you give a banquet, invite the poor, the crippled, the lame, the blind, and you will be blessed. Although they cannot repay you, you will be repaid at the resurrection of the righteous." While it is easier to teach the able-bodied than the able-minded, we are promised a reward for reaching out to those with varying degrees of disability. Jesus said, "It is not the healthy who need a doctor, but the sick." Our spiritual message is never wasted on those who have the greatest need for healing, both of physical, mental, emotional, and especially spiritual needs. Students with mild hearing impairments can be accommodated simply by moving them to the front of the room so they can hear better. Also, keep in mind that you hear yourself fine, but others may not if you fail to make some adjustments to your speaking volume and diction. Avoid turning your back when speaking. Another way may be to add more text to your presentations in the form of slideshows or handouts with your notes included. More severe hearing impairments may need interpreters. As with hearing impairments, students with mild vision impairments can also be accommodated simply by moving them to the front of the room so they can see better. Some students may need professional intervention, a doctor visit to prescribe corrective lenses. Include handouts with your notes. Arrange to print textbooks with larger than normal fonts. You may have to adjust your visuals for illumination, color, contrast, size, and distance. This type of impairment requires more patience than most. There are two types of disorders: expressive, how the student speaks, and receptive, how the student perceives the spoken word. Again, where the student sits may allow easier access to the teacher. I have never seen a deaf interpreter sit with the deaf participants in the back of a church service. Improve your nonverbal skills using hand gestures and more expressive body language. Be willing to wait until the speech impaired has completed their thought when responding to a question. Use clear, understandable language. All students learn differently. Some learn so differently than the norm that we classify them as having serious deficiencies. There are a wide variety of learning disorders, including dyslexia, behavior disorders, attention deficit disorder, hyperactivity disorder, language disorders, and motor disorders. It is important to remember that even if you are not a specialist on dealing with these various disorders, that these students are still made in the image of God, and that God can help you to reach someone who may seem unreachable. All of the things we discussed as accommodations for hearing, vision, speech, and language may be applicable to one or more of these learning disorders. There are also mobility issues or motor control disabilities. The key here is that everyone can be reached by the gospel. Everyone can be touched by the gospel. Everyone can be filled with the Holy Spirit. We need to seek God and depend on our training as teachers to respond to each individual's needs. For the next lesson, read these two handouts: Authentic Assessment and Assessment of Student Learning.